Hello guys and welcome back to Code Sparkle. So today I'm going to be discussing the CMSRN, the Certified Medical Surgical Registered Nurse Specialty Examination. So I have been in med-surg for a little over 2 years now, and I took the exam because I had enough hours and it's the main specialty I've done, and it's almost the main specialty I guess you could say I feel comfortable with. So I took the exam, and studying for the exam was a very, I would say, fun experience because even though I have been working med surg almost every day for 2 years now, there were a lot of things that I learned in the review process and studying for the exam that maybe I didn't harp on when I was studying for NCLEX or studying for like other just nursing school exams. What I loved about the exam is that it is a bit detailed, which I loved. And I passed on the first try, which I'm very, very thankful for. Um, the benefits of the exam are that it does provide professional recognition. You can demonstrate your expertise and commitment to excellence to patients, employers, and your peers. It's a nice thing to have on your resume. I believe the CMSRN, this is the one hosted by the American Medical Surgical Nurses Association, the AMSN. This one is valid for 5 years, so I wouldn't have to renew this till like 2029, which is a while from now. So it's pretty worth it in that. I mean, 5 years is a long time, so I think it's worth it in that regard. Career advancement, it can really open a lot of doors because you're getting extra certification in your specialty that not everyone necessarily has, which can have the potential of making you a stand out in a way, so to speak. It could have a high earning potential for some organizations. Um, Professional growth. That was one of the main reasons I took it. I definitely wanted to make sure that I'm always staying up to date and current with the best evidence-based practice, harping, and making sure you have the best evidence-based practice. Make sure that your patients are safe, that your peers are safe, that your organization is safe, the public is safe. It's always good to be abreast of all the medical advancements being changed. And with how wide medical surgical nursing is, there's been a couple changes, so that's one of the main reasons I took it, to make sure that I was very coherent, not coherent, current in best practice. And I really did learn a lot, or at least reinstilled a lot of the information I already knew. And quality care also too. It promotes a culture of excellence in healthcare institutions. I believe the CMSRN might be a magnet recognized certification. If I'm wrong, let me know in the comments, but I believe it's a magnet recognized certification. Therefore, magnet recognized hospitals show, our higher ups that, hey, the nurses here, the hospital here is dedicated to quality patient care, quality improvement, patient safety. Magnet recognition really does go a long way in the ratings of the hospital, but also to the betterment of the public. It lets the public know that, we're doing our best and we're making sure that you get the care you deserve. And then also confidence is a big one. I think if you are looking for something to kind of just boost your confidence as a registered nurse and you're in med surg specialty, definitely the CMSRN can be an amazing addition to your resume. So those are some of the reasons. Let's talk about I guess leading up to the exam, what I did to prepare. So I studied for the exam for maybe about a couple weeks. Keep in mind though, I have been in school taking some courses, so it's not like I've just been out of school and just decided to take this exam. I have kind of been taking a couple courses, nursing related courses in the last couple of years, so I didn't just take it like right out of the blue. I have continuing education requirements through a school, so that's number one. So I wasn't completely, I guess, out of school when I took it, or yeah. Number two, I believe the exam had 150 questions, and I did purchase the review course. So the AMSN has a review course online on their website, and I strongly recommend it. I think it was an invaluable resource to me. I don't think I would have done maybe as well as I did, I guess, or maybe if, I might not have been successful if I didn't take the review course. So there's a review course. There's also an app from, I believe, CMSRN. I forgot the name of this app though. Isn't that so funny? Pocket Prep. And I have it here. So there's an app called Pocket Prep, and they actually have, it says the MSN CMSRN. So they have 1,000 practice questions. I think I forgot how much I paid, but it might have been $20 a month. But this app was, for me, I think one of the major reasons I was successful. So there were 1,000 questions, and I completed 739. I think I'm gonna show you guys proof because I don't know. Ah, what a terrible lighting. Sorry guys, but so those are the questions I got correct. Not that great, but those are the questions I answered. So I went through 739 questions. And I honestly think that the app was a little bit harder than the exam. This is what I use. I would just do questions and then I went through the review course. But this is what I use. I would personally say that the questions on the app were harder than at least the version of the exam I had or the exam I personally had on that day because I wouldn't say the questions here were harder, but they were very, very detailed, which is good because every question I got wrong on the app, I had a notepad where I would like go over it or I'd read up on it or watch a video. So I loved that I did all these questions. I don't think I would have been as successful if I didn't. I'm just gonna give you guys just a sample of some of the questions they had. Let's see. Okay, it says here. I don't know if you guys probably can't read it, so there's no use in showing it, but let's say like this might have been a question, but the outer surface membrane of the wall of the heart is the epicardium. That's a bit of an easy question. Okay, you're treating a patient who has DK, and you're administering regular insulin. Which of the following lab values is most important to monitor? Potassium. That's a bit of an easy question too. I'm trying to find. Okay, this is a bit of a tricky-ish question. I wish you guys could read it because that's probably better for you guys. But it says a patient who has recently been diagnosed with insulin-dependent diabetes asks the nurse how the disease is likely to affect their kidneys. Which of the following is the best answer? The correct answer was about half of the people with insulin-dependent diabetes develop kidney disease within 2 decades of the diagnosis. A diagnosis of insulin-dependent diabetes, does increase the risk of kidney disease significantly. However, this increased risk typically only occurs later in the disease process. About 50 to 60% of patients with insulin-dependent diabetes will develop kidney disease within 15 to 20 years of diagnosis, and that is from the core curriculum of the Medical Surgical Nursing 5th edition, page 38. So, questions like intermediate acting insulins are effective for an appropriate duration of what, 14 to 18 hours. I mean, some of the questions you could say that I don't think they're hard, but some people might say that's hard. A patient is coughing up sputum with a musty odor that is bluish green in color. The nurse suspects which of the following conditions: pneumococcal pneumonias, A. Klebsiella pneumonias, B. Serratia pneumonias, C. Pseudomonas pneumonia is D. The correct answer is Pseudomonas pneumonia. Apparently, sputum pneumococcal infections is usually purulent and blood streaked and pink or rusty. Sputum and Klebsiella infections is usually sticky, red, and jelly-like. Sputum and Serratia infections produces peak expectorant with a sweet odor. So, and I think, yeah, and that I got that answer right, but I don't know if you guys can actually see the questions. This is a terrible. I don't think you guys can see it, so I'm gonna stop. But I did 739 questions, and I'm glad I did every single one because it was it was worth it, and I got like proper results. I can, and they give you your scores automatically at the end. It was, for me personally, I thought the exam was a little bit difficult for me. Like while I was taking it, I wasn't super confident like that I passed. Literally while I was taking it, I didn't think I had been successful, and I was actually planning on retaking it, but um, to God be the glory, I passed. So I think it's a great exam. I think, more people should be interested in taking it. I'm glad I took the exam because it has definitely just kind of shown my willingness to provide quality care, and I think everyone should give it a try. Studying for it was really fun. Honestly, if I had to take the exam again, I would. But I would, because I really did enjoy just learning so much more and harping on building confidence and practice. So think about it, guys. The CMSRN. Think about it, think about it, think about it. It's a great exam. I wish I had the let's see. It's a great exam. Definitely think about it. Think about, pursuing it. It would be great for you guys. I don't want to show you guys my. Hold on. Here, I don't want to show you guys my name, my full name, but there's no way to see this. I don't even know why I'm doing this. It's so bright. Well, it says, okay, well, it says pass, okay? Oh, girl. This one, why is there such, see the green? If you guys can see the green, it says pass. Ah, it's like you get it a little bit and then you don't. If you guys got a whiff of the green, that green is it saying pass, but I don't think you guys see anything. Okay, you see it there, see? So it says pass. And it gives you like, there's 5 sections: patient care management, holistic patient care, elements of interprofessional care, professional concepts, nursing teamwork, and collaboration. And see, pass. 107. So I think it's 107 out of 150 questions, but I also think that they said 25 of those questions were trial questions, so I think it's actually 107 over 125. And if that's the case, then I got like an 85. Because if it was 107 over 150, that'd be a 71. But either way, I passed. I have a certification, and I'm definitely going to use everything that I learned from this exam to better my practice. So thank you guys for tuning in. The CMSRN, really think about it. You guys will love the exam. I think it was was a really rewarding experience. So thank you guys for visiting Code Sparkle and have a great day.